Good morning, everybody. Just a second. Namaste, everybody. This is Dr. Mayur Kaku. I am a neurosurgeon as well as a yoga therapist, and this is Yenri channel. So, Yenri channel is Yoga Environment Neuroscience Research Institute. This we have conceived this concept to improve the collective consciousness of the society, to improve our experience on this planet. That is how we have conceived this idea. Today's session is about neurosurgery class, which is on traumatic brain injury. So, traumatic brain injury, as you can see, it is a very important concept for all of us because since antiquity, humans have been suffering from injuries to the head. Okay, so there is no doubt that head injuries happen by accident, by assault or any other manner. Okay, so what we have to do is to understand in terms of today's modern neurosurgical knowledge. I am sharing this with all my groups here. That is how we are having some time to wait. Okay, just a second. We'll start off. In a bit, we will start off. Okay. Now, I will share the PowerPoint presentation with all of you. Okay. So if you are able to see this, you can just tell me that yes, we are able to see. And you are most welcome to join the discussion on the chat. You can ask me questions over there. I'll be more than happy to answer your queries. Okay. I am watching it on my mobile if any chat is there. Okay. So namaskaram everybody. We are going to start now. So traumatic brain injury in modern life, the reason, two main reasons are one is alcohol and another one is helmet. Awareness about alcoholism, awareness about alcohol intoxication is very, very important. And helmet safety, road safety is very, very important. Okay. So what is happening? Okay. Tachanamurthy, yes, sir, slides visible. Thank you. Thank you very much, Tachanamurthy. So you can see here, those who are medical students, please go through the ill effects of alcohol and please go through the importance of helmet. I will keep on sharing slides and then we'll keep on moving. 135 slides are there. Those who don't know me, I am Dr. Kaku Mayur Vinay Kumar. I am MBBS CH gold medalist from NIMHANS and I have done my postgraduate diploma in yoga therapy as well. I am doing fellowship program also in health and healthcare management from IIHMR Bangalore. I have done a certification in culture of health consultant. So these are some different types of courses which help us to understand healthcare at a higher level. Okay. Approximately 55 lakh accidents happen and 12 lakh deaths happen worldwide every year. and 3,400 deaths are happening per day. So as per the report, a total of 4,61,312 road accidents have been reported by states and the union territories in India during the calendar year 2022, and which has claimed around 1,68,491 lives, caused injury to around 4,43,366 people. Now you see how these things happen. You see here. You can see here how this lady is walking. She is walking okay, but the road is not, whichever was constructed recently, the pavement, the footpath, whatever you want to call it as, is not working. They have not corridored it, and that is why she falls inside. We don't know what happened to her. So 25% of the head injuries are traumatic brain injuries are to the pedestrians, 17% to motorcyclists, 15 to four-wheelers, and 10% to bicyclists. 50% of head injury patients who die, they die within 2 hours. So there is something called as golden hour. We have to make our patients reach as fast as possible to the nearest super specialty hospital. So the irony of the situation is most neurosurgeons are available in metros, but our 70% of the population is in the rural areas. That is one thing. Second thing is helmets are not being used in the rural areas because people think that it's a rural area, there is not much traffic, what will happen? But it is exactly opposite. If traffic is not there, people are going to ride very rash manner. Now recently one elderly lady, she died because she was hit by a bull from behind. She did not even know, means that bull is coming from behind. So there are various reasons for head injuries to happen, and in rural area it becomes more kind of high velocity trauma than in the metro cities. Now what we are going to do is we are going to cover epidemiology, we are going to cover biomechanical basis, then neuropathology, animal models, genetics, neurochemistry, proteomics, and therapeutic strategies. If you are liking this, you can share it in with other people also. Another thing is that you can tell us that sir, we want more such classes also. Now you can see here, this is one of the prince of Rajasthan, and he was playing polo, and then after that he got hit by something on the head while playing polo, and now you can see him, he has sequelae of traumatic brain injury. He has recovered over a period of time, but he has multiple sequelae of traumatic brain injury. Many of you might be knowing this person. You can share in the comment section. Who is this person? Very famous person. He is no more now. And his name is Steve Jobs, and he is his friend partner. His partner had a traumatic brain injury because of aeroplane and small private jet they were flying, and it got hit, and then he had head injury, and following that he had lots of issues. Very famous personality, many of you might be knowing. You can share in the comment section by pausing or in the chat section. He is Michael Schumacher. Since 2013 he is also in coma, he is not well. Okay, now this person also, you can see here, he was a boxer, and now he is on wheelchair because while boxing he got hit by his opponent, and it had severe sequelae after that. Cricket, many of you know cricket. So cricket, Philip Hughes, and he is 63 not out because he got hit by a ball in the posterior aspect of the skull, and then he is no more. He had a vertebral artery dissection, and immediately his brainstem stopped working. Muhammad Ali, we know that he also had a lot of sequelae because of chronic injury, and that was Parkinsonism. 4,72,586. This is a different number of head injuries for not wearing helmets in 2014. What is the number in 2014? 15. So wearing helmet is very, very important. I urge all of you to please understand this and never take yourself for granted, never take others for granted. Now we can see here one video I will share with you. This video we had created in 2023. So now we will move on to epidemiology. As you can see, there is it's a big public health problem. It is a big socio-economic problem also. It is a silent epidemic. Potential harms and chronic sufferings are there. As you can remember, recently in Pune, one Porsche driver, underage and under the influence of alcohol, he went and hit two-wheeler and both the people died. So it is a very important public health problem. We need to understand how it is happening and all these things. Traumatic brain injury is happening in the form of road traffic accidents, falls, violence, sports injuries, and during the everyday activities of living. Epidemiology is defined as the study of frequency, distribution, and determinants of health conditions in human populations. Okay, so this is what is epidemiology: frequency, distribution, determinants of health conditions in the human population. Now, most of the head injuries are happening on Friday, Saturday, and Sunday. Alcohol is responsible in 38% of the cases. Drug abuse is responsible for 7% of cases. Now, infrastructure, most important in developing countries like India, what is important is infrastructure. Poor road design, poor lighting, poor maintenance, lack of pylon system, lack of safety measures, lack of signal and traffic control, all these things, they lead to accidents. Vehicular problems like seat belts people are not wearing, brakes are not proper, traffic is mixed, like some are slow vehicles, some are fast vehicles, and poor vehicle standards. Vehicles are not maintained properly. Post problems like me or anybody who is means host, like who is driving the vehicle. Now, some people are inadequate trained in driving. Some people don't comply with the driving rules. Some people have poor visual acuity. Some people are distracted. Some people are under the influence. Half of the world's population will have head injury over lifetime. More than 10 million people are affected due to traumatic brain injury every year globally. In the United States alone, there are an estimated 3.5 million traumatic brain injuries, resulting in 2 million emergency department visits, almost 3 lakh hospital admissions, and 56 deaths annually. 56,000 deaths annually. A temporary or permanent disability, cognitive, emotional, social, behavioral, and physical functioning domains. The financial burden of traumatic brain injury has been estimated at around 85.5 billion per year in the United States alone, multiply by 5 in general for India. So, approaches to classification. Glasgow Coma Scale score 3 to 8 severe, 9 to 13 moderate, 14 to 15 mild. Okay, then there is something called as Marshall classification. You can see here. Then there is something called as abbreviated injuries score is also there. Okay, here Rotterdam computed tomography classification is there. And then these are the international classification ICD code for head injury, injury to the head. Superficial injury, open wound of the head, fracture of the skull and the face bones, injuries to the cranial nerve, intracranial injury, concussion, traumatic cerebral edema, diffuse traumatic injury, focal traumatic injury, epidural hemorrhage, traumatic subdural hemorrhage, traumatic subarachnoid hemorrhage, intracranial injury with prolonged coma, other specified intracranial injuries, unspecified intracranial injury, crushing injury of the head, avulsion and traumatic amputation of part of head, other and unspecified injuries of the head. Between 18 to 95% of traumatic brain injuries are classified as being of mild severity. Globally, it has been projected that 759 per 1 lakh population are living with sequelae following traumatic brain injury. The prevalence of traumatic brain injury in United States has been estimated at approximately 5.3 million, means 53 lakh people. You can see in the areas of snow, the head injury incidence is high. Now, who are the people at risk? Children, that is 0 to 4 years of age, elderly patients, 65 plus years old, are at particular risks for TBI. In the United States, data from the CDC show a population-based mortality of 17.1% per 1 lakh and over the year 2010. The average life expectancy is reduced by 9 years after inpatient rehabilitation for traumatic brain injury. Cause of injury. The main causes of traumatic brain injury globally are transport incidents and falls. Gilbert stated that motor car had emerged as the most persistent killer in the Western world. Road traffic injuries place an enormous strain on the country's healthcare system and on the national economy in general. Between 1975 and 1998, traffic fatality rates increased by 44% in Malaysia, by up to 243% in China, and by up to 383% in Botswana. 62% of traumatic brain injuries are caused by road traffic incidents, 8% by falls, approximately 24% by violence, 4% result from work and sports related injuries. In the United States, the CDC estimated that between 1.6 and 3.8 million sports related traumatic brain injuries occur each year. These numbers include those for which no medical care is sought. Head injury is not equal to traumatic brain injury because head is a bigger part. You can see it has a face also, it has eyes also, nose, throat, everything is there. Okay. And traumatic brain injury has been defined as a brain damage resulting from external forces as a consequence of direct impact, rapid acceleration or deceleration, a penetrating object, example gunshot, or a blast waves from an explosion. The nature, intensity, direction, and duration of these forces determine the pattern and extent of damage. On definitions, also include cases of subtle behavioral or neuropsychological changes reported sometime after possibly trivial injury. It has also been suggested to include injury accompanied by any alteration in the mental state. Example, confusion, disorientation, slowed thinking, lack of standardized directory, recurrence, political underreporting. Successful prevention and reduction in the incidence of neurotrauma can occur by greater political action, by greater public awareness, so and the engagement of societies. So until and unless there is no political action, so if you can see, if we can improve the infrastructure of the highways, infrastructure of the roads being constructed, it will be under the control of government. So government has to take the action. Public awareness in terms of safety, public awareness has to be there in terms of alcohol related issues also. And then engagement of societies means various organizations have to come together and do some work in real time so that you know changes are observed across. You can see the one more advertisement for how helmet helps. I can see that today's election results going on. So still we have few people watching us. So thank you very much for joining in. So you can see how helmet has protected. Biomechanical basis of traumatic brain injury. Primary, secondary. Clinical classification like skull fracture, focal injury, and diffuse brain injury. Focal injuries are defined as visible damage to the parenchyma that is generally limited to a well circumscribed region. Examples of focal injuries include contusions to the cortex, subdural, epidural, and intracerebral hematomas. Focal injuries occur in nearly half of all patients with severe brain injuries and are responsible for approximately two-thirds of brain injury related deaths. Diffuse brain injuries differ from focal brain injuries and skull fracture in that they often occur without producing macroscopic structural damage, are associated with widespread brain dysfunction, and appear in approximately 40% of patients with severe brain injuries. Although diffuse brain injury contributes to the nearly one-third of the deaths from the brain injury, most important aspect of this injury subtype is that it is most prevalent cause of disability in survivors of traumatic brain injury. Concussion to coma. It is concussion very minimal, but it has disturbance. Coma is severe. Biomechanical mechanisms of head injury, like static versus quasi-static loading greater than 200 milliseconds. Dynamic loading is less than 50 milliseconds. Impulse loading, impact loading, blast over pressure loading. Penetration, perforation, or localized depressed fracture is more likely if the object has surface area of less than 2 square inches. Now, tissue properties and responses to loading. Like across these loading regimens, strain or deformation is considered the proximal cause of the tissue damage. The strain limit of bony and soft tissue before damage occurs depends upon not only the force, that is the direction, magnitude, and duration, but also on the mechanical properties of the tissue. Now, brain, you know that it is a very soft material, and its mechanical behavior is often based on descriptions used like rubber-like material, easily reaching deformation 20 to 40% before failing. So brain can move inside the skull. How much ever space is available, only few millimeters space is available, but it will move. It will have that kind of deformation. 20 to 50% also it can happen without any failure. Okay. Now you can see here tension, how it increases, compression, how it happens, and then shear strain. Okay. The amount of strain that bone can tolerate is actually less than that needed to injure the brain tissue. Bone breaks very easily at a 1 to 2% strain. Whereas brain and vascular tissue may not tear until 10 to 20% strain is applied. So bone will break very easily, but brain will not break You can see inside what is happening. The skull, because impact has happened, now skull is solid, inside brain is semi-solid kind of thing, rubbery like consistency. So it will move inside the skull and will glide over the skull base and the against the cranial vault. Okay, so you can see here. Acceleration injury, deceleration injury, translation, rotation, angular rotation, all these things. Skull fracture, linear fracture, depressed fracture, basilar fracture. Focal, epidural, coup contusions, countercoup contusions, intermediate contusions, then intracerebral hematomas. Tissue tear hemorrhages, like it happens inside the white matter, superior medial frontoparietal white matter, corpus callosum, centrum semioval, periventricular white and gray matter, internal capsule and basal ganglia, dorsal areas of midbrain and upper pons. Subdural hematoma, like because of tearing of the parasagittal bridging veins located along the superior margin of the brain. The subdural hematoma are associated with contusion and laceration, are sometimes called complicated subdural hematomas. Diffuse brain injury, cerebral concussion, reversible, diffuse axonal injury, angular rotation, acceleration. So this you remember, diffuse brain injury is happening because of the angular rotational acceleration, axonal injury. Okay. The brain tolerates sagittal movements best, and horizontal movements are somewhere between lateral and sagittal movement. So sagittal movement means this movement. Okay. This movement will be coronal movement. Okay. Secondary injuries. Now, after the primary impact is over, there will be secondary injuries. These secondary injuries are inflammation, reactive gliosis, edema, metabolic deficits, the increased reactive oxygen species, excitotoxicity, hypoxia, altered signal through the cells. Now, I am taking you through the neuropathology of the brain injury. You can see here, brain is there. Okay. You can see here, there is midline shift. You can see this structure is moved. This is the midline ideally. Then this structure is moved from this side to this side. Okay. There is temporal horn dilatation also. Here you can see midline shift. Here you can see something called as cingulate gyrus herniation. Cingulate gyrus herniation. You can see here subarachnoid hemorrhage, contusions, okay, basifrontal contusions, the medial temporal region also contusion, injury to the optic nerve. You can see here along the gray matter, there are these hemorrhages. This is gray matter. This is white matter. Okay. I'll pause here for a while, just a second. So we are back. Just a second. Yeah. So you can see these are specimens which are showing various kinds of changes which are happening. Now CSF volume is 150 ml, blood volume is 150 ml, brain parenchymal volume is 1400 ml, that is 80%. CSF volume is 150 ml, 10%. Blood volume is 150 ml, 10%. Okay, remember this. Now, when suppose something happens, tumor, hemorrhage, anything, then what happens? The CSF will drain via ventricular system. Venous drainage will happen via dural venous sinuses, and it will try to maintain the same intracranial pressure. Okay. The normal intracranial pressure is 200 millimeters of water or 15 millimeters of mercury. Okay. Now, when intracranial pressure increases, what is happening? Various herniation syndromes happen. cingulate herniation, uncal herniation, central herniation, tonsillar herniation. Death occurs in increased intracranial pressure as a result of cerebral perfusion failure, compression of medullary cardiopulmonary control circuits, and brainstem hemorrhages, diurate hemorrhages. These hemorrhages are also called as diurate hemorrhages. Effects of increased intracranial pressure. Space taking lesions of any cause may produce a common set of signs and symptoms by increasing intracranial pressure and leading to herniation syndromes. Increased intracranial pressure can result in compromised cerebral perfusion. If the pressure is asymmetric between the dura, defined compartments of the intracranial wall, then it can lead to herniation, as we discussed now. The cingulate, uncal, central, and the tonsillar herniations. Now, when uncal herniation happens, the cranial nerve 3 will get pressed, and because of that, there will be dilatation of the pupil and ptosis. Okay, and that is very localizing sign, exquisitely localizing, and still we can reverse it by urgent evacuation of the hematoma. Death occurs in increased intracranial pressure as a result of cerebral perfusion failure, compression of medullary cardiopulmonary control circuits, and brainstem hemorrhages. Okay, increased intracranial pressure can result from inappropriate accumulation of the CSF as well. Okay, with that understanding, we'll move on. So sometimes there will be false localizing signs. For example, this patient has ipsilateral hemiparesis because of Carnot's notch phenomenon. Brainstem will shift and get crux cerebri will get pressed on the opposite side. Homonymous heminopsia caused by PCA infarct. Cranial nerve 6 paralysis, and then papilledema. Now you can see here, this is third ventricle, hypothalamus. You can see here contusions here, and there is subarachnoid hemorrhage. Okay, it's brainstem. Fungus cerebri. If traumatic or surgical defect is present in the skull, the brain may extrude out of opening under increased pressure. This process is known as fungus cerebri. Cerebral edema. Now edema is happening cytotoxic when BBB is intact. BBB is blood-brain barrier. Vasogenic. Interstitial. Interstitial edema involves production of overproduction of or failure of CSF egress. The vasogenic edema often responds dramatically to the administration of corticosteroids that restore the barrier integrity, and particularly in tumors. But corticosteroids we don't give in traumatic brain injury. Okay. Now, anatomic structures which get involved in the traumatic brain injury are scalp, skull, dura, brain, blood vessel. I will pause here for today. I feel because already half an hour is over. We will cover this epidural hematoma, subdural hematoma, and all these things, chronic subdural hematoma, and all concussion, all these things as we move on with the classes. There are 135 slides, and I welcome all of you to join this session. It will help you to revise your subject pretty fast, and it will give you some basic ideas about road traffic accidents, traumatic brain injury, pathology, management, so on and so forth. Okay. So thank you. Thank you very much, everybody, for joining in. We will see you in the next class.